Welcome to my channel, RX Sam 2020. Today we discuss a drug named Levetiracetam. About Levetiracetam is a medication used to treat epilepsy. It is used for partial onset, myoclonic, or tonic-clonic seizures and is taken either by mouth as an immediate or extended release formulation or by injection into a vein. This medicine cannot cure epilepsy and will only work to control seizures for as long as you continue to use it. Medical use. For treatment of partial seizures, myoclonic seizures, primary generalized tonic-clonic seizures. What is epilepsy? Epilepsy is a central nervous system, neurological disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. Focal seizures, also called partial seizures and localized seizures, are seizures that affect initially only one hemisphere of the brain. The brain is divided into two hemispheres, each consisting of four lobes, the frontal, temporal, parietal, and occipital lobes. A focal seizure is generated in and affects just one part of the brain, a whole hemisphere or part of a lobe. When seizures are localized to the parietal lobe, numbness or tingling may occur. With seizures occurring in the occipital lobe, visual disturbances or hallucinations have been reported. Myoclonic epilepsy refers to a family of epilepsies that present with myoclonus. It starts on both sides of the body at once and lasts for more than a second or two. When myoclonic jerks are occasionally associated with abnormal brain wave activity, it can be categorized as a myoclonic seizure. If the abnormal brain wave activity is persistent and results from ongoing seizures, then a diagnosis of myoclonic epilepsy may be considered. Myoclonic seizures frequently occur in day-to-day life. During sleep, abrupt jerks and hiccups occurred. Generalized tonic-clonic seizure, or GTCS, previously known as a grand mal seizure, is a type of generalized seizure that produces bilateral, convulsive tonic and then clonic muscle contractions. Tonic-clonic seizures are the seizure type most commonly associated with epilepsy and seizures in general and the most common seizure associated with metabolic imbalances. Dosage. Adjunct in partial seizures. Adult, initially, 500 mg 2 times a day, BID, on the first day. May increase in steps of 1 gram at 2 to 4 weeks intervals until effective antiepileptic control is achieved. The maximum dose is 3 grams per day. Child, 4 to 15 years, less than 50 kilograms initially, 10 milligrams per kilogram, BID. May be increased by 10 milligrams per kilogram, BID at 2 weeks intervals. Adolescents greater than or equal to 16 or 50 kilograms, initially, 500 milligrams BID. May be increased by 500 milligrams, BID at 2 to 4 weeks intervals. The maximum dose is 60 milligrams per kg per day. Monotherapy for partial seizures with or without secondary generalization. Adult, initially 500 milligrams daily, increase after 2 weeks to 1 gram daily. May further increase in steps of 500 milligrams at 2 weeks intervals. The maximum dose is 3 grams per day. Dosage, intravenous. Adjunct in partial seizures. Adult, initially, 500 milligrams BID on the first day. May increase in steps of 1 gram at 2 to 4 weeks intervals until effective antiepileptic control is achieved. The maximum dose is 3 grams per day. No safety and efficacy data for intravenous usage greater than 4 days. Child, 4 to 15 years, less than 50 kilograms, initially 10 milligrams per kilogram BID via intravenous infusion over 15 minutes. May be increased by 10 milligrams per day BID at 2 weeks intervals. Adolescents greater than or equal to 16 years or 50 kilograms, initially 500 milligrams BID via intravenous infusion over 15 minutes. May be increased by 500 milligrams BID at 2 to 4 weeks intervals. The maximum dose is 60 milligrams per kg per day. Monotherapy for partial seizures with or without secondary generalization. Adult, initially 500 milligrams daily, increased after 2 weeks to 1 gram daily, may further increase in steps of 500 milligrams at 2 weeks intervals. The maximum dose is 3 grams per day. No safety and efficacy data for intravenous usage greater than 4 days. Contraindications. Hypersensitivity. Drug interactions. Levetiracetam does not contain all possible drug interactions. Special precautions. Renal and hepatic impairment. Patient undergoing hemodialysis. Abrupt withdrawal may result in increased seizure frequency. Reduce dosage if psychotic symptoms, for example hallucination, and behavioral symptoms, for example agitation, anxiety, occur. Pregnancy, Category C. Risk cannot be ruled out. Lactation, not recommended. Pediatric patients, not safe below 4 years of age. Elderly, no overall difference in safety were observed. Side effects. A blocked nose or itchy throat. Feeling drowsy, sleepy, or dizzy. Headaches. Feeling sick or being sick. Somnolence. Ataxia. Hairless. Depression. You should avoid or limit the use of alcohol while being treated with levetiracetam. Do not use more than the recommended dose of levetiracetam, and avoid activities requiring mental alertness such as driving or operating hazardous machinery until you know how the medication affects you. Brand names that are mostly prescribed by doctors. Keppra, Spritam, Levera, Levipil. Mechanism of action. The exact mechanism by which levetiracetam acts to treat epilepsy is unknown. Levetiracetam does not exhibit pharmacologic actions similar to that of classical anticonvulsants. It does not inhibit voltage-dependent sodium channels, does not affect GABAergic transmission, and does not bind to GABAergic or glutamatergic receptors. However, the drug binds to SV2A, a synaptic vesicle glycoprotein, and inhibits presynaptic calcium channels, reducing neurotransmitter release and acting as a neuromodulator. This is believed to impede impulse conduction across synapses. Thanks for watching. Please subscribe and like this video.